But they made you feel so good after they'd been there, you know, they made you feel like...
We had a rummage sale twice a year, one in the spring and one in the fall. It was a huge, big undertaking.
I said, no. I don't allow anybody in my house but the Norwell visiting nurse there.
Ensuring that care remains a key word in home health care has been our mission for over 80 years. In 1918, an influenza epidemic strikes the world, and by 1920, nearly 22 million people are dead. Women won the right to vote, and the League of Nations was formed, and in Norwell, in response to health concerns of the time, some prominent Norwell community members formed the VNA. Amy Sylvester, one of the founders, sold pies at the Marshfield Fair to fund the start of the organization. Based on the belief that need is opportunity, the board envisioned a vital community benefit organization to promote health and to provide care for the sick. In 1928, they started one of the state's first school-based dental programs with the purchase of a dental engine and paid the dentist to examine school children's teeth. For the first 50 years, Miss Catherine Rowe was the only Norwell visiting nurse. She was the school nurse, social worker, public health official, and health teacher. She helped to deliver babies and assisted surgery at home.
The class would line up at the door, and you'd walk in and see her. That's the way I remember. And then they would give you a little check in your eyes too, I think. And
during the next 2 decades, the stock market crashes, depression sets in, and World War II rages on. And back in Norwell, Miss Rowe continues to visit her patients at home in the car that the VNA purchased for $437. And like other towns of Scituate and Hanover, Norwell began the monthly Well Child clinics. In 1946, Norwell had the only dental clinic in the Commonwealth of Massachusetts free for all school children, with the VNA paying for these services. In 1949, the VNA arranged for free chest x-rays. During the 50s, the Boston Braves moved to Milwaukee, Disneyland opens, and physical therapy services were added to the Norwell VNA services. Payment for Norwell VNA services at home and in the community was through private donations and an annual family membership drive. For a $5 contribution, a Norwell family was entitled to receive home nursing and therapy, school physicals, and twice-a-year health screenings. Rummage sales and the annual appeal paid the nurse's salary, automobile, all health clinics, and immunization drives. We witnessed many social changes in the 70s, peace protests, the impeachment of President Nixon, and the expansion of Medicare coverage for the aged and disabled at home. The Norwell VNA recorded 891 nursing visits in 1970. During the 70s, Miss Rowe retired after 50 years of service, leaving a legacy of caring for Norwell and a growing organization. More nurses and home health aides were hired to continue her work. In the 80s, we saw the first woman appointed to the Supreme Court, and space travel became commonplace, and insurers and physicians discovered that patients really do improve more rapidly at home. In 1986, the Norwell Visiting Nurse Association is certified to provide a full range of home care services, and the demand for health services continued to grow. Admissions for home care increased by 50% in 2 years. Flu clinics were provided free to Norwell residents. Due to the increased number of staff and the growing need for home care, the VNA moved from the town hall to the Cushing Center in Norwell and opened another office in Scituate in 1994. In 1997, Tiger Woods won his first Masters, and in August, President Clinton signed the Balanced Budget Act of 1997. In response to the Balanced Budget Act, over 3,000 VNAs and home care agencies were forced to close or become acquired by larger organizations. With the closure of several local VNAs, the Norwell VNA was asked to expand throughout the entire South Shore region. By the year 2000, over 52,000 home visits were made possible by 100 professional and support staff.
And she is a hot ticket. And she checked him all over, and Mike's sister was up from Pennsylvania, and she says, after she left, she says, she didn't just check him, she gave him a real good physical. I said, that's Donna. She says, I never saw a visiting nurse do anything like that. I said, well, we got a good one.
Since entering this new century, we've added many programs and services to meet the growing needs within the 20-plus communities we serve on the South Shore. In 2008, we introduced a hospice program to provide full continuum of care to our patients. Bridging caring and cost requires balance, identifying parameters, and agency management. Today's Norwell Visiting Nurse Association and Hospice is expanding services, bringing care to where the people are.
How about working on the bending? Bend that all the way back up.
Our patients, your own family, friends and neighbors rely on the intense caring for the human spirit that drives NVNA and hospice. On any given day, NVNA and hospice is responsible for home and community-based services for more than 500 patients a day, caring competently and with compassion. It's the particular attention to the unique needs of the patients, families, and local community that distinguishes our service from all the rest.
The Norwell VNA in 2007 decided that it needed to reach out into the community and provide more services for its patients. We realized that many of our patients, as they approached their end of life, needed to move on to another facility. In 2008, we brought on board appropriate nursing staff and physician staff to help build the hospice. We decided that now our goal was to gradually build our hospice based on the needs of our community.
Through our falls prevention program at the Norwell Visiting Nurse, which is a multidisciplinary program, we're looking at all the components that go into why a person might fall. We're dealing with things like blood pressure issues, low blood pressure.
No other home health care provider in the region has sustained its connection with and remains committed to caring for this community and its residents. Our role has remained timelessly consistent with community needs, and that's why thousands of patients we have served over the years affectionately refer to us as our VNA.
Well, several years ago, the Norwell VNA and Hospice developed, probably about 6 years ago, developed a support group for Alzheimer's caregivers. And what we do is we offer a lot of education. So 1 month we'll do support and just talking amongst each other, sharing ideas. And then the next month we'll bring in a speaker, depending on what the group decides they want.
Our gratitude to our donors really can't be measured, and I think that since the very beginning of the organization, community support and benevolence is really clear in what saw the services through the past 80-something years.
The people on the board today are really business people, you know, they need to be. They need to be, really.
Board members are very talented community members who really have their finger on the pulse of what's going on in their community, and they keep us focused on what the community needs really are. Most of the board members bring with them their own personal and professional expertise in terms of abilities that we would need for a successful nonprofit in today's world.
Our uniqueness has been our ability to respond to fiscal challenges and technological developments efficiently and effectively.
I think technology has, I really truly believe it has resulted in better patient care. I think we've seen the result of telemed and our hospitalization rates. You know, we've really improved them. So I can't even imagine going forward what we're going to do.
The Chronic Disease Self-Management Program is an evidence-based program. It was developed by the University of Stanford. And what the chronic disease is a program. It's a 6-week program. And it's anybody who has a chronic disease or somebody who cares for somebody who has a chronic disease.
Over 5,000 volunteer hours are contributed annually to Norwell VNA and hospice endeavors. At Norwell VNA and Hospice, we know that demand for home care has increased tremendously and will continue as America ages. Today's cost of providing care is higher than what insurance pays. Medicare has reduced and adjusted payments each year, and as the economic difficulties persist, the cutbacks are likely to exact an ever greater toll on the sick. Local, efficient healthcare delivery by caring professionals makes sound fiscal sense. Bridging the past with the present while planning for the future highlights the importance of NVNA and hospice's continuum of services that addresses both the public health and home care needs of a community. Your assistance is an investment in the health of your family, your friends, your children, and theirs. Your gift, however large or small, will help provide critical care at home for those lacking in means. Fund innovative ways for NVNA and hospice to perfect home health care and ensure that Norwell Visiting Nurse Association and Hospice is always available when you, your loved ones, and friends need our care.
People used to stay in the hospital long enough to be well when they came home, and they don't do that anymore. So the visiting nurses really have to do a whole lot more than we ever did.